Seeking help is one part of the process, but finding the right financial option for mental health services is one of the biggest obstacles, especially for college students. For senior biological sciences major Patterson White, cost was the leading reason he chose to sit on a wait list to use one of USM's mental health care services, the Center for Behavioral Health.
The prices for what I was looking to get done were like tremendously cheaper doing it through the school rather than going to like a off-campus location. And so I didn't really explore anywhere else because I knew that the saving money was the main reason that I was going to do it through the behavioral health clinic.
The National Council for Mental Well-Being reports that nearly half of the American population rates finances as the top barrier in receiving mental health care. USM provides solutions to students looking to ease the financial burden of these services through the CBH and student counseling services. The CBH charges students on a sliding scale, but at a rate that can be much lower than what students could be paying off of campus. White said he paid a flat fee of $200 after his first visit that covered his following appointments for the semester. And students can access SCS for up to 8 free counseling sessions per semester.
Any services that you would get from us, you've already paid for by paying your tuition. So none of the resources that we have or services that we provide in-house cost a dime. We do have the ability to refer out to other resources on campus or off campus, but we always make sure that students are aware if there's fees associated with that.
But the story can be much different for students looking to get help off of campus. Some sessions can cost around $190 an hour for private coverage, and students have to deal with finding facilities that accept their insurance. Casey Johnson started his private service, The Garden Counseling, after working as a counselor at SCS. Johnson has seen students able to find coverage off campus, but makes it a point to refer people back to SCS if they cannot get their services covered.
Students, don't have insurance that will cover mental health services, and student counseling services and for those people is a much better deal, being that it's free confidential counseling for currently enrolled students on campus. But then there were a few who have insurance, and it wasn't that big of a financial commitment to come over with me and see me off campus.
According to the White House's Council of Economic Advisors, half of adults find their health insurance does not adequately cover mental health services.
I know that a lot of the time for insurance policies, mental health benefits are different than regular benefits. So where it covers if you go see your doctor for a cold, it might not for counseling. But every policy and every insurance company is different. So that really depends on how the patient is covered as far as what they'll pay for different services with us.
An insurance agent, Chase Norris, said that most plans are network-based, meaning students must have in-network providers to cover their services.
They are network-based. If they're out of network, they're not going to cover it. Very few plans now are, they call it a PPO, where you're able to go in and out of network. You'll have a higher cost if it's out of network. They've gotten away from that.
Some students have been able to find services that adjust rates to their situation, but many may have to pay higher rates out of pocket. White advised students if their primary concern is cost, the simple route is to go with USM, but White said be prepared to wait to get into CBH. He waited a year before his first session. CBH Director Christy McCraney declined a request for interview.
If you want to save a lot of money, do it through the USM Behavioral Health Clinic, but you better get on the wait list early.
This has been Charlie Luttrell for USM Reports.